Welcome! This video is part 9 of a 9-part series and is intended for state, tribe, and territory disaster behavioral health coordinators and others involved with disaster planning, response, and recovery. The learning objectives in this video are to understand how your plan is integrated with the state, territorial, or tribal disaster behavioral health plan. Understand the importance of plan maintenance, including timelines for updating plans, and finally, to identify the different methods of making your plan accessible. 2 key processes to ensure that your disaster behavioral health plan will be useful well into the future are to conduct a crosswalk between your plan with other disaster response plans in your jurisdiction, and to include a process for regular review and updating of your plan. It helps to think of your disaster behavioral health plan as a part of a greater system of emergency planning. If it is to function within that system, it has to work with the other response processes with which it will interact. When you do that, you ensure that your plan will be visible to all the other participants in the larger state or county emergency operations plan. This includes not only the state agencies, but also local emergency management entities. Crosswalking your plan with public health, mental health, and substance use partners will enhance the effectiveness of your plan while avoiding potential conflicts in the field when your plan is implemented. Also, include any provider agencies or organizations that are part of your plan or may have plans of their own. These partners could include nonprofit mental health and substance use providers or organizations like the American Red Cross. As a process, integration must be proactive. It has to include state emergency management and other partners in the process. Including partners during the planning process is a much easier task than inviting them in after your plan has been developed. There are some other benefits to an inclusive approach as well. One is that it becomes a group process, and a group process is going to generate more ideas and better cooperation. It also creates buy-in among the participants. When you finally implement your disaster behavioral health plan, it also has to conform to the legal and regulatory standards in which it functions. So you need to take the time to review your plan with the State Emergency Management Planning section. Keep in mind that this step has to occur before your planning process concludes. Clearly articulating a method for maintaining your plan is critical if the plan is to be valid a year from now, let alone 3 or 5 years down the road. When it comes to good planning, a few key elements are helpful to keep in mind. Be sure your plan includes a timeline for updates. Additionally, be sure that it identifies who is responsible for updating the plan, that it's made accessible by various methods, that it includes instructions for ongoing exercises and trainings, and finally, that it contains instructions for the rollout of the plan. Let's discuss these a little more in depth. Your plan should be considered a living, breathing document. Planned stewardship is key to ensuring the plan is updated on a routine basis. It is the utmost importance for the plan's administrator to support this view, and equally important to identify a revision cycle and know who will maintain the plan. Your plan needs to identify who is responsible for the plan update. Most frequently, this falls to the Disaster Behavioral Health Coordinator. Next, you need to make the plan accessible. You can use various methods to ensure that any updates and revisions to your plan are shared. As stated earlier, a disaster behavioral health plan functions within a greater response system with multiple moving parts, and participants in each of those parts must be aware of any changes or revisions to the plan if it is to be implemented effectively. A key point is that inclusion in the process has an impact on the effectiveness of the outcome. The people who get drawn into the process of revising the plan become better educated and updated on how things work. This concludes the plan integration video within the Promising Practices series. Thanks for tuning in. The other videos in this series will explore each of the standards that can enhance your state disaster behavioral health plan. To view an expanded version of this video, go to www.samhsa.gov/dtac/webinars-podcasts and scroll down to the Promising Practices in Disaster Behavioral Health Planning series. Established by the Substance Abuse and Mental Health Services Administration, SAMHSA, the Disaster Technical Assistance Center, DTAC, supports SAMHSA's efforts to prepare states, territories, and tribes to deliver an effective mental health and substance use-related response to disasters. For training and technical assistance inquiries, you can call SAMHSA DTAC toll-free at 1-800-308-3515 or email dtac@samhsa.hhs.gov, or you can visit www.samhsa.gov/dtac. Before we conclude, we'd like to give a special thanks to Steve Moskowitz, who contributed the original content of this video.